Oftentimes, people experience adverse drug reaction as a result of a particular medication. According to the Adverse Drug Reaction National Database released in 2016 in Nigeria, over 2,000 cases were reported. This is a far cry from reality. Today on Sound Health, we will get first-hand information on how to manage and avoid adverse drug reactions. I'm Olasumbo Mudupe. Welcome to the show. Okay, thanks for staying with us. It's still Sound Health on Lagos Television. Today, Dr. Chioma Ejekam, a public health physician and a drug safety expert, will take us through adverse drug reaction. Welcome to the show, Doctor.
Thank you, Simbo.
Okay, looking at the body system, the field of medicine, oftentimes we hear drug reaction. What makes a person react to a particular medication?
You know, there's a thin line between the good thing the medicine is supposed to do and poison, okay? Now, there are a million and one things that could make somebody react to a drug. Let me start with the ones that you don't have control over before I move to the ones that probably is your own, you caused yourself, or, yeah. Now, there are genetic dispositions. Some people would just genetically, you know, because of things that they are born with or how they were created, will react to certain drugs. A typical example, there are certain persons, when they take a septrin, they will have a problem. They have scratch, itchy, rash, then goes to something more serious. Like, of course, chloroquine. There are certain persons that will scratch with chloroquine and some others will not. So that's genetic disposition. Then you have drug-drug interactions. There are certain drugs that if you take them with another one, there will be a reaction. You're not supposed to be taking with another one. Or there are certain drugs that they say do not take with food, and you take with food. That's one reason, again. Now, I'm trying to make it quite simple. Then the other one would be polypharmacy, what we call polypharmacy. When clients or patients see doctors and you just write one drug, they feel, this doctor, is that all I'm going to take? So polypharmacy is when you put, okay, typical example when we treat malaria in Nigeria, which is wrong, you put a multivitamin, Bico, all sorts of things with anti-malaria. So these things could make, you know, could cause or react to a drug. Then self-medication. You prescribe a medication for a child. The mother will say, okay, the doctor prescribed this, so this other child is having something similar. I will give this, you know. So these are other reasons. Then you have medication error as well, when the prescriber now, or the doctor, for instance, gives a medication error, basically giving the wrong medication, maybe at the wrong time, the wrong route. There are certain drugs that are supposed to be taken maybe for intravenously, but the instruction says maybe give in an IV, in an intravenous fluid over 30 minutes. The prescriber or the healthcare provider gives the medication push. These are very practical cases we've seen or we've managed as, you know, experts in this field. So these are some other reasons that could make somebody react to a drug. There are certain drugs, again, that it could just be a manufacturing process or the storage.
Could it be as a result of overdose?
Absolutely. Overdose could come under when I say self-medication as well. You know, a lot of things could come out from self-medication. Either you had an overdose, or you didn't know this drug should not be taken with the other one, And even, of course, lack of awareness definitely as well. There are part of the reasons that could cause reaction.
Okay, oftentimes we hear side effects and adverse drug reaction. Are there any similarities? Are they the same?
For a lay person, or let me not say lay person now, even any person who is not an expert in drug safety would see them as the same, but they're actually very different. Now, I will try to, because I'm speaking to the public, I'm not talking to medical students or experts, doctors or healthcare providers. Now, side effects, I'll use examples to make it come to life. Side effects are unintended, first, effect of a drug, but is related to what we call pharmacological property, as in the makeup of that drug. A typical example is in treating tuberculosis patients, there's a drug they call rifampicin. When it is given, one of the things we'll tell the patient is that when you go to urinate, you might see that your urine is red in color, but don't panic that, I'm bleeding and all that. That is a side effect of rifampicin. Because as much as we know this may happen, the person giving the drug did not intend to cause that, but it is known with the makeup of that drug. Do you understand? Something like chloroquine as well. When you counsel the patient and say, you may itch with chloroquine. But of course, if it goes really bad, as in all over body, you should tell your doctor. That will be a side effect of chloroquine. Now, an adverse drug reaction, of course, from English, adverse, overt, okay, is again, it's the difference a little from that in definition is one, is a harmful and unintended. You see the one I told about rifampicin. It is not harmful, but you've only told this client that if you go, watch out for this. But this is harmful, unintended response to a medicinal product. This is actually the simplest definition recent in the past 2-3 years. Before this time, it's a little complex defining it, that it is unintended and harmful, but related to the normal dose you give to somebody. So meaning that there was not overdose. You gave, this is the normal dose you're supposed to give to treat, but this medicine, the response became unintended and harmful. So if you look at the definition, meaning that the question of overdose, if somebody has an overdose and reacts, meaning that you will not expect the doctor to report because they said this is an overdose. So to make it simpler, any response to a medicine that is harmful and not intended is an adverse drug reaction. That's the recent global definition of adverse drug reaction. So I don't know if you use them, but you understand the definition, the difference right now. Yes, side effect, unintended, but again is known because of the pharmacological property of the drug you're given. Okay. But an adverse drug reaction, of course, overt, adverse, then is unintended and is harmful. Response to any medicine you give somebody. Okay. Yes.
In your response earlier, you mentioned some patients cannot just take Septrin without reacting. We also have people taking paracetamol, cough syrup, and some anti-malaria. What could be the reason behind the adverse drug reaction?
It goes to what I talk about, what I mentioned earlier about genetic disposition. The drugs you mentioned now seem to be in one family right now. You mentioned Septrin. Cough syrup could be very minimal, but let's say Septrin. We're mentioning brands right now, ideally. I'm not supposed to be saying brands. I call the name of the product, but say Septrin, Fancida, some anti-malaria, Fancida is there. These are people that react to sulfur-based drugs. You understand? So such persons, what we miss as, because I'll take, why your question is why just can't your people take something simple and not have a problem? There are two parts to that problem. First, they already have a genetic disposition to having the thing, but it could have been checked. One way is that when the person, first, knows self-medication. Second, the prescriber is supposed to first take the history. Do you know? You may not know, but counsel the person in case you take this medication and you notice, because they don't just happen exactly. No, it could happen, but it doesn't happen and become worse the next second. There's a gradual, there's usually a progression. If you take this medication and you notice that there's a rash or your skin is itchy, please report back to the doctor. This singular emphasis could save the very bad situation. So this is where we should focus on, because you can't do anything when somebody is born with having to react to sulfur-based drugs. And some people may never just know. That's their first time. So there's always a first time. But if you say that the person that knows that whenever I take anything, we give them the commonly available drugs in the market that they have this sulfur-based thing, and tell them, if you take it and have this, please tell your doctor. So they now, with that knowledge, when they see another healthcare provider, they can say, okay, when I took this, I had this, and it's written on the person's case note. That's the right thing to do.
All right, that has been Dr. Chioma Ejekam, a public health physician and a drug safety expert on managing adverse drug reactions. Next week, we'll bring you the concluding part. Up next is trending and home essentials. Please stay with us.
immunotherapy to treat leukemia and lymphomas.
Are we getting closer to a better treatment for cancer? Treatment for many cancers remains mostly as surgery, chemotherapy, and radiation therapy. Unfortunately, for patients whose cancer returns after intensive chemo and other traditional treatments, options are close to none. There's promising news coming for children and adults fighting the battle with leukemia, as well as non-Hodgkin's lymphomas. One of the first cellular immunotherapies is about to hit the market, and early results suggest that these diseases, even in advanced stages, may be curable. T cells are units of the blood critical to the immune system's ability to detect and kill cancer cells. Chimeric antigen receptor, CAR T cell therapies, represent a type of immunotherapy where T cells are removed and genetically reprogrammed to seek and destroy tumor cells. The groundbreaking treatment is expected to be presented to the FDA in 2017, with hopes to trigger a wave of approvals for many blood cancers and lymphomas.
That's Sound Health this week. Hope you've learned a few things on managing adverse drug reactions. For comments and enquiries, please share your thought with us on 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.